Hello, and welcome to the CDO Magazine interview series. I'm Sezin Palmer, EY's Health Data and AI leader, and today I have the pleasure of speaking with Karl Hightower, Vice President and Chief Data and Analytics Officer at Stanford Health Care and School of Medicine. Karl, thank you so much for joining us. So, as you're looking at different ways to leverage AI, I mean, you've talked about like ambient listening and kind of helping with efficiency and getting better insights. Are there any areas where either, maybe by Stanford policy or kind of your perspective, are there any areas that you don't think we should be considering AI-based solutions for healthcare?
So there are lots of things that you do within like understanding and knowing, a patient. When you walk into a retail store, there's facial recognition that's being used to identify you and be able to tailor kind of the environment to you. This is where you have to have an ethics and governance board to be able to decide whether you want to do that. There's a tremendous amount of technical possibilities, but should you be doing that? And that's one of the things where I really love having the leadership here at Stanford that, they're very thoughtful about how they want to apply these things. The discussions are very open about it. And in the past, these are parts of any time that you're having technology or AI or any use of data, you really should go into what does it mean to the company and should you be doing this? Those are hard decisions because it may also not directly be the best financial decision, but it's one that you have to look at long term as who do you want to be?
Yeah, yeah. So it sounds like really putting kind of the patient first and looking at, is this the right thing to do for our patients? And
Absolutely.
everything else is kind of secondary. Okay, that's great. So maybe shifting gears a little bit. You mentioned you have experience across many other sectors.
Yeah.
So when you look at the state of healthcare, and particularly data and AI maturity in healthcare relative to other sectors, what are your thoughts in terms of what we need to focus on in the healthcare sector? What do you think is really possible in the next 3 to 5 years? Kind of like, how do you think about where this is all going, given where we're starting?
Predicting 3 to 5 years out is really going to get me in trouble, um, because you look at just the progression of generative AI and how it's going. I mean, I could say that modeling data and cleaning data won't be necessary because it'll automatically be done tomorrow. I mean, heck, even doing analytics in the methodology that we're doing today is going to be, am I talking to the computer and just asking it questions? There are so many possibilities that go with that. I really have to kind of go back to basics and just decisioning. So why do we process all this data? Why do we do all of the things that we do? And it's so that someone can get an answer to make a decision and move forward. There's action that has to happen. So it's almost how do I simplify it so that I'm not overproducing things and I'm really focusing on how are people making decisions and what are the actions that they're taking and make sure that I'm hitting that mark no matter what's there. Whether that is creating a complex model for them to be able to evaluate images and text and all of this other stuff together, that mixed modal, or whether I'm just focusing on simple reports back and forth to get a number. I have to focus on how people are using that information. And I think that's going to get interesting in the next 3 to 5 years because I think it's going to get really, really cool on how to process and really get to those answers. The more information that becomes available, but I think that it should also get simpler on how it's being used.
Right, right. Yeah, it would be wonderful if tomorrow all the data was clean and ready to go, wouldn't it? So, and I know recognizing you're kind of still early days in this role and kind of setting the stage for where you want to go. What are you putting in place, or what are the things that you're going to be putting in place soon in the near future to enable your vision in terms of all the ways that we can take advantage of these latest and greatest new capabilities?
So it's interesting. No matter the industry, data is king on being able to do this. So I look at having all data at time to be able to make whatever decision needs to be made. So how much can I automate and take off people's plates so that they can do kind of the higher level work, um, and not have to spend as much time trying to prep things. So I think a lot of my early role is going to be really understanding how people use information, how they're using decisioning, and getting as much of the automation out of the way so that there is a platform from which they can be able to build things and quickly deliver results. It's kind of the setup, man. If you're looking at it, really the point guard distributing the ball so that people can actually score as much as possible. So I think that's kind of my early role, and also just kind of looking at what that technology is going to be for the next generation.
Yeah, yeah. And so can you say a little bit about how Stanford's approaching this from there's a lot of capabilities that you're probably working to put in place. Are you looking to do these kind of internally, or are you working with vendors out there, and if so, what are some of the things that you'd really like them to be providing to you?
So, the external pitch, of course. So one, Stanford has a tremendous amount of internal talent. Some of the smartest people in the world, and you go, okay, so how do I get them to be able to do what they do best? And that's where you look at the partners who can kind of take on the harder, kind of the more mundane things of moving data, cleaning data, kind of doing all of that stuff, and providing those platforms. As you start to look at agentic AI, which is orchestration of those different agents and creating the toolboxes, that's where you look for the partners of, okay, is it one platform? Is it multiple platforms? How do I create this logical, safe place for people to be able to do things? And it's also, how do I create an environment where partners can come in with those ideas and work with our teams at Stanford to be able to deliver that next generation value? So I think that type of an environment, um, given all of the information that exists, that becomes more powerful than farming data out and only working on the one problem. It's really that compound interest of providing an environment to work from.
Yeah, yeah. No, that makes total sense. So, obviously you're out in California, the land of innovation and entrepreneurship and everything. What would be the one thing that you would ask all those great innovators and innovative companies to focus on that would have the biggest impact on improving healthcare in our country?
It's interesting. So if you look at innovation, you kind of break it down into, am I just moving things incrementally forward? Am I trying to do the same model, make the horse faster? It's harder to look at a green field around healthcare. And this comes into plugging through it. I hope that the regulations start to lighten up on how hard it is to get through and introduce things. Um, and also just allow people to be able to try things. From a risk tolerance perspective, you know, how do you offer those to patients? So creating that type of an environment would be amazing. That's going to require a little bit of lightening on the FDA and government regulations to allow people to understand the risks as they get into the next level of healthcare. Um, so with that said, is well, how do you help people be able to innovate? And I go into there's kind of that environment. It's very hard to break in to healthcare because there's a tremendous amount of data that they don't have. They don't understand a lot of the nuances of it. So I think that's where you start to look at creating that environment for people to come in and work and play around delivering that just actually just changing the environment of healthcare itself. And that's I think why you come to Silicon Valley. I think that's why you're here at Stanford, is just because this is the type of environment that I believe will change how healthcare is practiced.
Yeah, absolutely. Well, we're all rooting for you. Our healthcare depends on it, right? Karl, I want to thank you for your time. Is there anything that we didn't get to explore in this conversation that you'd like to share about your work and your focus at Stanford?
No, I will tell you though that being here, just the teams have been amazing. Everyone's been so welcoming and receptive. It's been phenomenal coming in, and this is also one where just a tremendous amount of opportunity, but it's also with healthcare. Um, Keep in mind, this is like 30 or 40 businesses all simultaneous together. It is one of the more complex things that you can get into. So um, it is an opportunity. At the same time, it's also just a wide open landscape of things to get done. So
Yeah, very exciting.
Awesome.
Well, I hope we have a chance to follow up in the future and hear
Yeah.
how it's been going. Thank you, Karl, for joining me today. For more interviews and insights, please visit cdomagazine.tech. Thank you.